My name is Patrick Hong, and this presentation will be on the reporting of imaging diagnostic accuracy studies. We'll discuss baseline adherence to STAR 2015 and guidance for a STAR imaging extension. There are no potential conflicts of interest to disclose, and this project was supported by University of Ottawa Faculty of Medicine and the Department of Radiology. Imaging research often evaluates the diagnostic accuracy of an imaging test in detecting a target condition or disease. For example, an accuracy of MRI for detecting or staging of prostate cancer. Published diagnostic accuracy studies are often not completely reported, and this hinders the reader's ability to evaluate risk of bias, determine the generalizability of study findings, and it ultimately limits reproducibility. And this incompleteness in reporting may serve as a barrier to clinical implementation of the latest evidence. In 2003, the Standards for Reporting of Diagnostic Accuracy Studies, a list of 25 essential items that should be reported in every report of a diagnostic accuracy study, was published in more than 24 journals. It has been endorsed by many journals in the instructions for authors, and the dissemination of STARD led to modest improvements in the reporting of diagnostic accuracy research. The STAR group recently updated their reporting guideline. Several original items were removed or reworded, while 9 additional items were added. STAR 2015 now incorporates 30 essential items. It is important to note that the STAR items are not specific to imaging studies. They apply to all types of diagnostic accuracy research, including microbiology, laboratory tests, physical exams, and screening questionnaires. However, imaging journals produce a substantial amount of diagnostic accuracy studies, probably more so than other fields of medical testing. The level of adherence of recent reports of imaging diagnostic accuracy studies to STAR 2015 is not known. Assessing the baseline adherence to STAR 2015 is critical and will allow for targeted interventions towards persistent deficiencies and those identified among new items. Knowing that baseline becomes important for measurement of improvement over time. And furthermore, detailed assessment of sub-items, specifically relevant to imaging, is important to allow for specific guidance for imaging research. For these reasons, our objective was to evaluate the adherence of recently published diagnostic accuracy studies in imaging journals to STAR 2015. In consultation with the medical librarian, we performed an electronic search of MEDLINE. The search encompassed diagnostic accuracy studies published in imaging journals with the previously published search filter for diagnostic accuracy studies, restricted to 127 imaging and radiology journals. The time span of the search was modulated to reach a sample size of 100 to 150 included studies by restricting to those published between April and May of 2016. Studies were included if they met the following inclusion criteria. 1. Reporting on a study in which the diagnostic accuracy of one or more imaging index tests was evaluated against the reference standard in human subjects. And 2. Reporting at least one estimate of diagnostic accuracy study. We excluded studies pertaining to predictive or prognostic studies, reviews, letters to the editor, systematic reviews and meta-analyses, commentaries, and studies published in languages other than English. The following baseline characteristics were extracted. STARD adoption status was evaluated by looking at each journal's instructions for authors. A journal was considered a STARD adopter if its instructions for authors explicitly recommended adherence to STARD or STAR 2015. And more importantly, the adherence to STAR 2015 was measured. Each reporting requirement was rated as yes, no, or not applicable, and the overall adherence was measured using the total number of STARD items for each study, which could range from 0 to 30. In the case that STAR 2015 items had more than one component, the item was divided into sub-items that were scored independently. Items regarding test methods with potential aspects unique to imaging research was divided into multiple sub-items. Items rated as not applicable were scored the same as a yes, regarding adherence, and received a point with fractional points awarded for each subitem. An arbitrary classification with regards to reporting adherence was divided as infrequently reported, moderately reported, and frequently reported. We performed an analysis to confirm normal distribution. ANOVA was used to evaluate differences in starred adherence related to country, journal, study design, imaging modality, and subspecialty area. Students' t-test was used to evaluate the differences in starred adherence depending on journal's impact factor, study design, and starred adoption status. The search strategy yielded 724 published studies. After screening title and abstracts, 169 potential relevant studies were identified. After full text, 142 studies were included in the final analysis. The flow of studies through the selection process and reasons for excluding studies is outlined in this figure. Characteristics of the included studies are outlined in this table. The number of studies corresponding to country of corresponding author, published in starred adoption journal, journal of publication, median journal impact factor, subspecialty area, study design, and imaging modality are represented. This table presents item-by-item summary of adherence of the included studies to the STAR 2015 statement, and it corresponds to the frequently reported items. Some of the items that we want to highlight include item 10, item 10.2, and 12.1, which corresponds specific to imaging research. This table presents some of the infrequently reported items in our cohort of included studies. The items that we want to highlight include item 13.2b, item 22.2, and 25, which could introduce a risk of bias and reduce generalizability of the research findings. Our subgroup analyses reveal that journal publication, journal impact factor with median split, and journal starred adoption status show significance. Radiology and the British Journal of Radiology report the most items compared to the journal with the lowest number. Studies published in higher impact factor journals reported more items than lower impact factor journals. And starred adopter journals reported more items compared to the non-adopters. In conclusion, STAR 2015 adherence by recent imaging diagnostic accuracy studies was moderate, with just over half of 30 items reported on average. Items specific to description or interpretation of imaging tests were generally frequently reported, and several items critical to assessment of risk of bias or generalizability of study findings were infrequently reported. STAR 2015 introduced 9 new items. Most of these items were frequently reported in our cohort, and this may indicate that despite the lack of STAR 2015 as guidance for authors at the time of the article submission, these items are already being entrenched as best practices for reporting in imaging journals. Several new START items were infrequently reported and are in need of improvement. These include sample size calculation, registration number and name of registry, and accessing study protocol. Only 5% of diagnostic accuracy studies report details on sample size calculation. A small number of diagnostic accuracy studies reporting a registration number may be related to the lack of guidance for registering diagnostic accuracy studies and the absence of appropriate registries. The differences between starred adopters and non-adopters is modest, although significant. Many items remain absent in studies reported in starred adopting journals. Progressive policies of starred adopters might serve as best practices for other journals, and it should be noted that the publications from top reporting journals are far from completely reported. Here are the advances in knowledge through our current research. Recently published imaging diagnostic accuracy studies show variable adherence to STAR 2015. It was associated with journal impact factor, journal starred adoption status, and journal of publication. Nonetheless, it was not associated with study design, subspecialty area, country, or imaging modality. Thank you so much for listening to the presentation.